Fentanyl poisoning has now become the leading cause of death of Americans between 18 and 45. This travesty must end.
Fentanyl is a powerful synthetic opioid that is up to 50 times stronger than heroin and 100 times stronger than morphine. And as Governor Abbott highlights, overdose deaths are becoming more common. Welcome to In Focus Texas. I'm your host, Carla Leal. This week, we are taking an in-depth look at the fentanyl crisis and how lawmakers and advocates are fighting back against the epidemic. In Texas, more than 5,000 people died of drug overdoses between October 2021 and October 2022. That's according to the CDC. Overdose deaths involving fentanyl in the state also rose an astounding 399%. This legislative session, Governor Abbott is calling on state leaders to propose measures that will prevent overdoses, such as legally defining fentanyl deaths as murder and increasing the supply of Narcan. At the Capitol, advocates are also putting pressure on lawmakers to prevent opioid overdoses. Our JJ Maldonado has the latest.
Paulette Soltani is on the front lines of reducing drug overdoses.
What we're dedicated to doing is working to build power with people who are impacted by the war on drugs.
Paulette is the director of organizing at Texas Harm Reduction Alliance. She's driving through East Austin, where the Alliance does community outreach. The Alliance is pushing lawmakers for additional resources when it comes to fighting opioid overdoses. They're hoping lawmakers will hear their plea at the steps of the Capitol as they push for expansion of Narcan, affordable housing, legalizing fentanyl test strips, and authorizing harm reduction centers.
Our crisis has never been at this height before, and so we need to be using every single tool that we have in our toolbox, and fentanyl testing strips is just one piece of it. We need so many other things.
According to the Texas Department of State Health Services, it's estimated nearly 1,700 deaths are linked to fentanyl in 2021, an 89% increase from 2020. In places like Travis County, officials are concerned fentanyl deaths are rising.
This year, it looks like the report is going to show that the number of deaths are probably going to double in similar categories of fentanyl overdoses, opioid overdoses, and it will still be the leading cause of accidental death in Travis County.
Travis County Judge Andy Brown is referring to an upcoming medical examiner's report that is expected to be published by the spring. Meanwhile, Paulette says they will continue to meet with lawmakers and keep making demands to save lives.
The victims of the fentanyl crisis in our state and across the U.S. come from all walks of life. Those who have lost a loved one to fentanyl poisoning, as is the case of our next guest, Becky Stewart, know this well. Becky, welcome to In Focus Texas, and thank you for speaking openly about this difficult topic.
Thank you for having me.
Well, I know you and your family have gone through a lot since your son Cameron died. What do you want Texans to know about your son Cam?
My son Cam was, he was your everyday all-American kid. He was funny, one of the funniest kids I've ever known. He was charismatic, charming, handsome, tall, 6'4", 184, an incredibly talented athlete. He was a state champion hurdler, just an overall happy kid. Since this tragedy affected our family, it has really impacted me in the way I look at those overall American families, because you can't say, not my child. If it can happen to my family, it can happen to anybody's family.
So what have you been doing since his passing to try and prevent other fentanyl poisoning deaths among youth?
Shortly after Cameron died, I realized the urgency to get the word out there and to warn others of this dangerous drug. And I created a nonprofit organization called A Change for Cam. It's created specifically to go out and educate students, parents, and communities on the dangers of fentanyl. Anything I can do to bring awareness to this #1 killer of Americans, ages 18 to 45.
What are some of the bills that Texans should pay attention to or advocate for to help fight the fentanyl crisis?
Well, one bill specifically that has been introduced is House Bill 3908. It's Tucker's bill. It's my friend Stephanie's son, Tucker, who also passed away to fentanyl poisoning. She has garnered support from a representative, Representative Terry Wilson, to introduce this bill, and it's to have Texas schools provide fentanyl awareness education for 6th graders on up. And this would be a requirement, and so it's actually going to put it in front of the students and be able to not have us moms and grieving families be the ones knocking down the doors of the schools trying to get something done.
And I know that your son Cam is featured in a powerful billboard ad in several highways of Central Texas. Share with us, how did this project come about and what has resulted from it so far?
Yeah, he's on a billboard. It came out actually just 2 weeks ago. One in Jarrell and one in Smithville. The one in Jarrell is right off of I-35, and it's a pretty impactful billboard. It just says, "Fentanyl kills, just ask my mom," with a picture of Cam. And it came about, I was calling about a billboard where I live, and I called the company Media Choice to see how much it would cost to put up a billboard, and told her what I was wanting to do. And that snowballed into the owner was being very supportive and wanted to donate a couple of spaces that were available. I have received so many calls from people who've been on 35 saying, "I was just driving south and saw Cam on the billboard." And I've even had a couple from Smithville say they've seen the one off of 71. I do have some more billboards coming out. We're going to include other faces of victims. It's not just all about Cameron, but the media company wanted to really make a powerful impact, and I think that one did it. So one I just found out today is going to go up off of 620. It's going to be a vinyl billboard. He grew up right down the street from where this billboard's going to go. So it's going to be a very impactful, I think, message to that area. Lots of people travel that road that knew him and loved him, and it's that double-edged sword. It's good that it's up there, but it really stinks at the same time.
I can feel your pain from here. I admire your strength and your wisdom.
Thank you.
Thank you for sharing it with our audience. Is there anything else that you want to share with Texans while we have you?
You know, one message I always say is never say not my child. There are so many parents out there that do have great kids, and we're not talking, these are just kids who are abusing substances. Some are out experimenting for the first time, losing their lives, and they're not getting the chance to learn from their mistakes. They're dying from them. So just don't say not my child, never my child, because it can be your child. Just have conversations with them and know what's going on in their lives and educate them.
Becky, thank you.
Thank you. I appreciate you having me.
Coming up, we'll tell you about a vending machine in the capital city aimed to help save lives among those struggling with substance use. Welcome back. Cities across Texas are finding different ways to reduce overdoses. In the capital city, a Narcan vending machine was installed at an organization known for caring for individuals who may be suffering from addiction. JJ Maldonado spoke with a harm reduction worker about the demand for the nasal spray as overdoses skyrocket across the state.
It's one of Austin's only Narcan vending machines. Advocates say the demand for it is needed now more than ever.
So this machine right here, nice Narcan in case of emergency.
Stephen Smith points out a vending machine filled with the overdose prevention medication Narcan.
Overdoses have been rising, and this is like just one part of the puzzle. But at the same time, you know, this needs to be at many more places because of the overdose deaths that is occurring.
Narcan has been used to reverse effects of opioid overdoses. Steve, who works with the Texas Harm Reduction Alliance, says advocates have been working together to come up with solutions to prevent the number of deaths caused by overdoses.
Narcan is provided from different organizations in the community.
The Narcan vending machine was set up by the NICE project. Pastor Mark Hilbelink with the Sunrise Church, where the machine is located, says the location is ideal.
We work with so many different groups, like a lot of the anonymous groups, and also are able to, in our homeless community, be able to be the main point of resource in the community for services that are integrated from healthcare, mental health care, harm reduction, substance abuse, housing.
Steve says the goal now is to get more vending machines like this one out into the community to reach everyone everywhere who is either going through drug addiction or knows someone who may need it.
And naloxone, also known as Narcan, the nasal spray that reverses drug overdoses, will soon be available without a prescription. The Food and Drug Administration just green-lighted the opioid reversal medication for over-the-counter sales. Experts claim making the spray more accessible can reduce overdose deaths. Narcan maker Emergent Biosolutions has not specified how much the spray would cost. Some pharmacy chains sell it for around $100. Francesca Ray with Texas Harm Reduction Alliance recently spoke about the importance of making it readily available for everyone here on Spectrum News 1.
It should have never been restricted in the first place. It's a life-saving drug, and the people that need it are the people who have the hardest time accessing it, right? So not only people who use drugs, but people, really everyone should carry it, but specifically people who are working in places with single occupancy locking bathrooms, like convenience stores, Starbucks, places like that.
Numerous organizations across Texas are taking steps to treat and prevent substance use, mental health, and other issues tied to the fentanyl crisis. Bluebonnet Trails Community Services is one of them. Jack Houseworth is their sorter director. Thanks for joining us, Jack. What is Bluebonnet Trails doing to make Texans aware of the dangers of fentanyl?
We have a substance use intensive outpatient program in about 19 locations that there's substance use counseling with adults and adolescents. And one of the big things that we're concentrating on now is the fentanyl crisis. Another thing that we do is we're also the OSAR for Region 7, which stands for Outreach, Screening, Assessment, and Referral. And we cover 30 counties in kind of central Brazos Valley, Central Texas, Brazos Valley area. And with our OSAR program providing outreach, we are going and providing presentations to a lot of schools, the churches, going to town hall meetings, whatever we can to get the word out.
Jack, as you were sharing, you serve residents of Central Texas. How big is the drug abuse and or poisoning problem in your region, and what are the needs of those reaching out to Bluebonnet Trails and to address substance use?
Along with substance use goes mental health issues, goes a lot of trauma. We see a lot of trauma, and we do a lot of trauma-informed care counseling. The fentanyl crisis is not getting better. It's getting worse. We're starting to see fentanyl in just about every drug that's out there, not only in pills, but in marijuana, in methamphetamines, in cocaine. We also have a partnership with Williamson County EMS where we do post-overdose education. They have reversed 30 overdoses since January 1st. And then we come in and provide the post-overdose education where we bring people into substance use services or mental health services or whatever other kind of resources that they may need to try to combat this.
And I understand Bluebonnet is also taking steps to make the medication that can reverse opioid overdoses readily available. Tell us, how are you guys doing this, and why is it important for more people to have access to naloxone or Narcan?
We think everybody should have naloxone. We do that, and we will offer naloxone to anybody that wants it out there right now. We have just in our 8-county and actually in our 30-county OSAR area, we have provided Narcan to school districts, to churches, to police departments, first responders. In Williamson County, they're putting it in their AED machines. So everybody that we come in contact with from really the government on down is recognizing this life-saving drug, and they're willing to allow us to come in and do education and teach them how to use it, and also to provide them with this. So.
All right, Jack, thank you for connecting with us.
Fighting the fentanyl epidemic in Carrollton Farmers Branch ISD. I'm Ashley Cluster. I'll show you how the district is working to get parents involved. Coming up.
Thanks for keeping it here. One North Texas school district is getting parents involved in the fight against fentanyl. The message the district instills in students is one pill can kill. And as our Ashley Cluster shows us, now parents are also learning about the dangers of opioids.
Maria del Carmen Perez Esparza graduated from CFB ISD. She's also a mother to a CFB ISD alum and a grandma to a current CFB ISD student.
And I am also a co-president of my parish for the parish council. So, of course, this affects my community.
That's why she made it a priority to come to this parent meeting.
I want to see what I can do to help.
The goal is to show families how the district is teaching students about fentanyl-laced drugs.
It used to be 4 out of 10 pills have fentanyl, and now it's 6 out of 10. It's really like playing Russian roulette when taking a non-prescription pill.
Joe Gillen with the district showed families the exact presentation they show the middle schoolers and high schoolers in class.
Parents are scared. We're scared. We want our students to be scared.
You know, it's heartbreaking that not a lot of parents came.
Then the second half of the presentation was focused on empowering parents to parent their kids.
And to not be afraid to look at the social media accounts, get the passcodes to their telephones, where they are.
She raised 6 kids. She told parents the kids are gonna hate you at some point for checking their phones.
They are.
But it could be the difference in your child living or not.
Sir, does she use narcotics?
Sophia's father telling him he doesn't think so. He only knows of her smoking a little weed.
The video was very touching that we saw.
In this real video, Narcan is used to save the life of a young girl who took a pill she didn't know was laced with fentanyl.
50 times more powerful than heroin.
That Narcan saved her life. CFB ISD says it has these inside all of the defibrillators at every campus. After seeing this, Esparza is getting Narcan too.
I sure am. One for my home, for my car. It's probably the new fire extinguisher.
At the state level, leaders are also proposing legislation that would require teachers to be trained to administer Narcan to students. 8 bills have been filed that would require school staff to have some sort of emergency training. These measures cover a wide range of topics, including use of overdose reversal medications and setting training standards for school personnel. Well, the fentanyl crisis is something Texas parents are becoming all too familiar with. Lourdes Vasquez introduces us to a mom who hopes a bill that's going through our state legislature helps her find justice after her daughter's sudden death.
Jasmine's mom wants the individuals who gave her daughter fentanyl arrested, and a proposed bill changing overdoses to poisoning could help prosecutors charge those responsible with murder.
What's it called?
A villa.
This is Jasmine Daniel 4.
This is the face of fentanyl poisoning. This is not a phase of overdose.
4 was a mother of 3 and a certified nurse. Due to a back injury at work, she was prescribed painkillers.
But she did have a valid prescription, but you have a certain time to cut that prescription off, and they didn't.
Jasmine's addiction to her prescription led her to seek out the opioid outside the pharmacy and instead the community. But Michelle believes as a trained nurse, Jasmine would have never willingly taken fentanyl.
When you take one pill and you die, that is poison.
And a new bill passed in the Senate.
Been 30 ayes and no nays. Bill passed.
Would change overdose deaths to poisoning.
So it will allow for the death certificate to indicate that fentanyl poisoning contributed to the cause of death.
Senator Joan Huffman's Senate Bill 645 would bring steeper charges with poisoning being a cause of death.
The amendment adds that a person commits the offense of murder if they knowingly manufacture or deliver fentanyl and an individual dies from the consumption of that substance.
No one has been charged in Jasmine's death, but Michelle is hopeful with the proposed bill, police will be able to take action.
We want justice for Jasmine.
Before we leave you, we'd like to share some resources on fentanyl. If you or someone you love is struggling with addiction, help is available. Texas Health and Human Services is available by dialing 211 and selection Option 8. You can reach the Bluebonnet Trails Community Services 24-hour crisis line at 800-841-1255. There's also the 24/7 crisis text line available by texting TX to the number 741-741. And finally, you can contact the Texas Harm Reduction Alliance by calling 512-585-7145. Well, that'll do it for this week's In Focus Texas. I'm Carla Leal. Thanks for joining us as we take a look at the fight against fentanyl here in the Lone Star State. Take care, and we'll see you next time.
Thanks for watching our YouTube channel, and for more refreshing stories about your community, click the subscribe button right over here. You can also download our Spectrum News app to get live news coverage, weather alerts, and more wherever you are. And don't forget to tune in to Channel 55 on Dish and DirecTV for live local reporting every single day. We'll see you then.